Welcome to another segment of KCS Youth Radio. Happy National French Toast Day. I'm Anjali Krishna and I'm in 6th grade. I'm one of the KCS Kids Club leads. We are continuing the Giving Thanks series with clips of the KCS Kids Club interviewing a few of our healthcare workers.
Hi, my name is Joyce Biju. I am in 7th grade and I am one of the KCS Kids leads.
Hi, I'm Anjali Krishna. I'm in 6th grade and I'm also one of the KCS Kids Club leads.
Thank you so much, aunties, for joining us today from work or in between your shifts. As you probably know, during Thanksgiving, especially this year, the whole world is thanking you for what you do every day. Aunties, it would be great if you guys could introduce yourselves, your name, and what you work as and what you do.
My name is Dr. Bindu Anand. I am an internal medicine specialist. I work in a community hospital nearby. I take care of COVID patients as well as non-COVID patients. So that's what I do.
Thank you. Preeti auntie, can you introduce yourself?
Hi, എൻ്റെ പേര് പ്രീതി. ഞാൻ ന്യൂറോസർജറി യൂണിറ്റിലെ റിസർച്ച് നഴ്സ് ആയിട്ടാണ് വർക്ക് ചെയ്യുന്നത്.
So I want to know, what do you do in your job and what do you work as?
I do the bedside nursing. So since we started this pandemic, usually we don't have the regular public population in my hospital because it's a research facility. We get only, those who are enrolled in the research. We do take care of mostly like epilepsy patients and brain tumor patients. So they are enrolled in the epilepsy, they might be taken a lot of medications, but it's not controlling their seizures. So they will be enrolled in research program. And some patients we do treat with, we monitor their seizure events and they figure it out which medication they're suitable for it and they try on it. In some patients, we may have to do some surgery, and that will help them to cure that seizure.
You say hi, please, and introduce yourself.
Hi, I'm Tini Philip.
Do you mind telling us what your job is called?
My job is called, I'm a neonatal intensive care unit nurse, NICU nurse. And go ahead.
Oh, no, go ahead.
Yeah. Well, you want me to describe what I do for the babies?
Yeah, sure.
So, if it depends on what kind of, if they are extremely premature, if they were like born 24 weeks or something, they are very sick at that time. So they will be on a ventilator. Then they do need a central line to give IV fluids and all the nutrients that they need. And they do need a lot of blood work to be done to see how their lungs are functioning and everything. Head ultrasound will be done. Echocardiogram will be done for them, so that, we need to know every organ, the function of every organ. Sometimes they have a chances of having bleed in the head. So we need to find out early so that we can support them. If there is any problem with the heart, we need to find out, and then so that we know if there is any medication that we can give to help them, all those kind of things, every single thing. So it depends on each baby, but that's what mostly we take the vital signs, we feed them, we have to start IV for them, and they need every support from us. Every single thing, because the parents are not there all the time. They'll come mostly visit and go home. So we are there as their parents. We'll be there for them.
So would these babies be more likely to get sick when they're older, or would their immunity be low?
So that is, each baby is different. Some babies are vulnerable for infections very easily if they were very sick at the beginning. But sometimes, when they'll come back after 5 years, sometimes after 10 years, they will come back and we will never even think, oh, they were such a tiny babies. We started 1 pound baby. That's the smallest baby we start taking care of, a baby who's 1 pounder. So they will come sometimes to visit. They are so tall, huge. You will never even think that they were there in the NICU with us for 3 months or 4 months. And then once they outgrow, they have all the immunity, they have the strength, they are fine to good to go. But sometimes, some of the babies whose lungs were injured, or if they had issues with their brain or something, they are more vulnerable for infections or diseases like that. So each cases are different. It depends on each baby, how the outcome was.
Has introduced a group of kids from the KCS Kids Club who have came here to ask some questions. First, we are starting with Aditri Nair.
Hi, my name is Aditri Nair. I'm in 4th grade. When I grow up, I want to be a neurologist for animals.
Next, we have Ananya Kalai.
Hi, my name's Ananya Kalai. I'm in 6th grade, and when I grow up, I want to be a teacher.
Now we have Gautham Anand.
Hi, my name is Gautham Anand. I am in 3rd grade. I want to be in the Space Force when I grow up.
And now we have Ishaan Kumar.
Hi, my name is Ishaan Kumar. I'm in 2nd grade. When I grow up, I want to be an architect.
Hello, my name is Keerthi and I'm in the 5th grade.
Hi, my name is Taji. I am the Director of Staffing Resources and also Interim Clinical Director of a COVID unit in one of the main hospitals in Northern Virginia.
Can you explain what you do as a clinical director?
So as a Clinical Director of Staffing Resources, I have a staff who goes to a different units like ICU, emergency room, and also the acute care units. As a clinical director of a COVID unit, I am responsible 24/7 for functioning of that unit to make sure we take care of the patients safely and qualitatively. Evidence-based practices are carried out, and we want to make sure the staffs receive the training to make sure the patients are taken care.
Bindu Auntie, you said you were a physician?
Yes.
Could you explain more on what you do?
So I'm a doctor and I take care of patients in the hospital setting. So basically, the patients who are sick enough to be admitted to the hospital, I take care of them. So when someone comes to the ED, the ER physician will see them, the emergency physician, and then they will decide who needs to be admitted. Once they make the decision, they call me to see those patients who need to be admitted. And they get admitted to the floors where I kind of round on them daily, see them daily, examine them, go through their labs, as well as with their imaging like X-ray, CAT scan and everything, and make decisions regarding what treatment they need, what specialists they need to see, and all those things. So I take care of them during their hospital stay till they get discharged back to home or back to any facility.
Okay, so how do you know if the patient you're working for has COVID?
So since the start of the pandemic, since March 2020, we've been testing every patient that comes through the ED onto the floor. So they have a rapid test for which we get the result back in like 2 to 3 hours. So before we go to admit these patients, most of the time we have the results and we can decide.
Thank you. So which department do you work for?
I am an internal medicine specialist, so I see medical patients.
Oh, okay. So do you have to change what you wear when you go from one patient to another?
No, but I have to change into the hospital scrubs when I go into the hospital, and then I had to put on my gear, my face mask, and all those things. And for COVID patients, I got to change my gown every time I come out of the patient's room. So there's a whole process. I need to be wiped down, my face mask, everything needs to be wiped down with the bleach wipes. And I cannot use the same stethoscope or anything. I have to leave it there so that you don't carry it on to your next patient.
We have a question from a special guest in the KCS Kids Club Hangouts. Her name is Anslyn Burgess. So go ahead and unmute.
Okay, so my question is what type of patients do you take care of? Do you take care of just adult patients, or do you just take care of just kids patients, or old grandpa patients? What type?
So I take care of adults 18 and above, and they can be anywhere from 18 up to 104 or whatever number. So most of the time they come in with medical issues. Maybe some come in with pneumonia, fever, bleeding, stroke, heart attack, any of those things. And I follow them through the hospital course.
Okay, thanks. What about you, Priyanti?
I've been taking care of adult population.
What do you do to look after COVID patients?
I really do not touch the patients unless it's an emergency. I am in the unit and I jump into. But we do have a 24/7 responsibility, as I mentioned, so I can go into the patient rooms. We have built this unit with 24 negative pressure isolation rooms to make sure the patient is taken care safely. What is negative pressure room? It's an isolation technique that we use in hospitals to prevent cross-contamination from room to room. It includes ventilation that generates the negative pressure, that's pressure lower than the surrounding area, to allow air flow into the isolation room, but not escape from the room to the outside.
Is COVID a concern now in when you're in your job and where the babies are all born?
COVID is of course a concern. The main problem is the parents cannot come visit together to visit the baby. We used to let them come together. They used to hold the baby. They used to be there together. Now we are only allowing one person at a time at the bedside. They can only visit a single person. That's not comfortable for both of them. They are the parents. They want to be together at the bedside. They want to hold them together. Want to be part of the baby's care. That cannot be happening. That's not happening at this time. So it's difficult. And we have to be really careful because the babies are very small. We do not want to pass an infection to them. So it's a very big concern, especially for the babies. So we take all the measures to help them not to get any infection, to provide all the helpful things to keep the baby out of any sickness, to get any infections or anything like that. So it's a big concern for us.
So since you have to take some safety precautions, is each baby in a different room, or are they safe and within?
They are in a big like a hallway, I would say. It's a long hallway kind of thing. Babies are each baby has a very small bed or crib. That's where they will be. And they have a safe distance in between them. They are not in separate rooms. The babies are not in separate rooms. They are in one room, but it's a long, big room. And we are making sure if sometimes the parents can be they are COVID positive, and we won't be letting the parents to come in to see the babies. That is another difficult situation for us and for the parents also. Parents want to come and see the baby, but if they are positive, we don't want them to come into the NICU so that they don't spread any infections. So that is a big concern for us now. And when we go for any deliveries or anything like that, we have to put all the safety gears so that when we go there, we should not be catching anything, nor we won't be passing on anything to the babies. So we do try our best.
I wanted to know, what does it mean by being born premature?
Premature. Usually the babies are in mom's womb for 9 months. Some babies come out early, sometimes like 6 months, sometimes after 7 months, they come out early. So then they are very small. Sometimes they cannot breathe on their own. They cannot eat on their own, things like that. So they cannot be with the mother. Then they come to the ICU. So they have a bed. That bed is it is heated. So whatever the baby needs, the baby will be inside that bed. All the warmth and everything will be given by that bed. And so then they do need a lot of care. They do need a lot of attention, support with the breathing, support with the feeding, every single thing. So that's why they are very, very fragile there. So we need a very, so much attention. We have to give so much attention to them. And it is very important to give so that, they can grow, they can, without any complications, they can go home with the parents.
Okay,
that's what
thank you.
Baby, yeah.
I have a last question, sorry about that. So would a baby born 1 week earlier than it was supposed to be born, would that be considered as a premature baby?
No, if the babies are born after 37 weeks, mostly it's called 40 weeks. 40 weeks is what the full-time babies, regular normal babies. If they are born after 37 weeks, we are not calling them as a premature baby. So 1 week early, 2 week early, 3 week early, they are okay. They will be okay. They'll be going to the parents. If they are less than 35 weeks, that's when they come to the NICU. That's when they need a lot of help and support.
Thank you.
What are some important skills you need to work in the healthcare field?
The important skills. You have to be very compassionate. You have to be very knowledgeable in the area wherever you're working. You have to be very knowledgeable. And you have to have a very good communication skills. You have to work together as a team. A good team. You have to be a good team player when you work with a group of people. So I think those are many.
Preeti auntie, do you have it?
And I think we have to have a quick acting skills. If you see an emergency, we should very quick enough to act to that situation, because some of the things we need to act very quickly to recover and rescue the things. And we should stay calm always. That's another thing, when we become panic and stressed out, that changes the entire scene. And we should be very calm, passionate, as other Andy said, and act quick and think smart, which is best for the safety. And always we have to ensure the safety of the surroundings and ourselves and the public. We have to ensure the safety.
Okay, Bindu auntie?
I would say keen observation and detailed examination of the patient, as well as think outside the box. Sometimes you might think this patient might be coming in with these particular symptoms, so it fits into this particular diagnosis, but it may not be true. You have to think outside the box, think about different differentials. So there's a lot of thought process involved. So at the same time, when there is an emergency, do not panic, stay calm, have control. Then only your brain will function, and that will help you to kind of make the right choices for the patient. Then interpersonal skill, communication skills, these are very important. Talking to the patients and as well as to their families or loved ones, so that you communicate clearly what is going with the patient or to the family, because there will be a lot of anxiety with the patient as well as with the family, because they are coming in pretty sick. So I think those are the most important skills. There are many more, but the most important skills.
Yeah, they're all really important skills that you'll need. My second question is, do you give toys, pets, etc. to patients to improve their mental health?
We don't provide any toys or anything, but we do provide some certain things to patients who are elderly with dementia, I don't know the name of that particular thing. It's like a mat where they can play around with it. So I have seen those being given to the elderly patients with dementia.
Yeah, we have dog therapy in our clinic. In addition to that, we have the recreation team. So they will come and visit the patients every day and they talk to them, give them the games, everything. So I had seen them coming with the dogs and they stay with the patient. They like at least 30 to 45 minutes they spend with each patient. Some patients, they miss their dogs too. So it gives them a chance to mingle with the dogs too.
Okay. Next, we have Aditri with her questions.
You have only like more younger age doctors since they have a lower risk to COVID?
No. We do have older doctors and middle-aged doctor. Everybody is there. And
Go ahead.
No, when and even nurses or any other healthcare workers, those who have been working there in the field, they are all there. No one left, or no one is scared to come to work or anything like that. They are all there to help the patients.
Initially, when the COVID started, we kind of decided as a group that the folks who are young, who do not have any illness, like say no diabetes, no heart problems, as well as anyone who is pregnant, they are high risk, right? So we decided that we would not let those people be involved in the care of the COVID patients. So we wanted to kind of protect them, and we were doing that.
My second question is, how are you treating cancer patients and COVID patients at the same time? So, for example, do you have different sets of doctors for different sicknesses?
So patients who come in with underlying issues who have COVID, it's the same doctor who will be treating them, because right now we will be focusing on the COVID and its issues. But if they have, say, underlying cancer or cardiac issues or a stroke or a neuro issue, then we consult the consultants, the neurologist or the cardiologist. So they'll be also on board to kind of help to manage these patients.
My first question is, why did you choose to be in the healthcare department?
I think from a very young age, I wanted to be a doctor because my uncle was a doctor and I wanted to follow in his footsteps. And I also was very compassionate about it, like being involved in caring people and doing something for your community.
Keerthi, if you'd like to answer.
I think I followed my sister too. She was in the healthcare field too. So when I was joining nursing, she was in the nursing field. So I followed her. So
my second question is, what do you like the most about your job?
For me, I feel really happy when I see that I have made the right diagnosis, treated someone who got better, and so that makes me feel really good.
Preeti auntie, if you want to add to that?
That's the same kind of, when they comes very sick and when they go home very well and healthy, and they were able to take care of themselves, that makes feel better because we made a change in their life.
Okay, so now we have Ishaan to ask his questions.
My first question is, how are you brave enough to face COVID patients?
That's a very good question. So when COVID started, it was scary. We were anxious. We did not know what we were facing, if the measures that we had taken is going to protect us or not. Are we going to go get sick? We were not sure. But I think in every hospital, everybody got together. We had lots of meetings where we kind of talked about the things that we need to do to put a protocol in place. So when I go to see my COVID patients, I have someone, a buddy outside, who kind of tells me how to do my things, because when you're in a hurry, you might miss stuff. And then if you miss stuff and contaminate yourself, you can get sick. So I would have someone outside telling me how to put on the gown, or to help me tie the gown, double glove, go into the patient's room, examine the patient, take out the thing, come outside, close the door, and they wipe me down. So everyone did their part really well. We all worked as a unit. And then that kind of gave us the strength to face this unknown. And I think we have done a good job so far in kind of protecting the healthcare workers from falling sick. And all those measures have kind of acted out well. But unfortunately, the numbers are going up now because the community, the people have had the fatigue where they don't want to wear the mask or social distancing. So the numbers have gone up now. So we still have a big fight ahead.
What would a working day look like? Would you have multiple coworkers like working with you on one specific baby, or would you be working?
Before COVID, life was totally different. We didn't have to isolate any babies if the parents were positive. We get very few babies, the parents who are positive. We don't get a lot at this time, but so one nurse will have 2 babies or 3 babies most of the time. So that nurse will be taking care of those babies. That nurse will be responsible for every care for that baby. But if we need help or anything, other nurses can come and help us.
Okay, so I have another question. So has the visiting hours changed during this lockdown, when the visitor hours, they would only be from a certain time to a certain time? Have they been shortened, or how can you explain the rules of the visiting hours for their babies?
So for us, the visiting hours is 24 hours a day. The parents are allowed to visit. And so we haven't changed that policy, but the only thing that we changed, no siblings are allowed, no relatives are allowed, only one parent at the bedside at a time. So because we want to keep the safe distance, we don't want crowded people. If we have 12 babies and then we have 12 parents at the bedside, that's not safe in the unit. It's a closed unit. And then we have staff, so that's a lot of people there. So that's why we limit only one person at the bedside, one at a time. So that person goes back, and then the significant father or the mother who wants to come and visit, they'll come and visit. So that's what mostly they do. So our visiting hours haven't changed, but the policy have changed a little bit with the other relatives or the siblings visiting.
Okay. So do you feel safe taking public transportation if you do?
If I have a mask on and there is no closed ventilation, and there is we are 6 feet apart, then if really needed, I can do that. So basically what we have to remember is that we have to protect our nose and mouth as well as our eyes, because these are the ways it can get transmitted. If someone is there who is positive, then this mask is not going to protect us, because the N95, I did carry some just to show you, but Rajmol auntie had already shown you all these things. So these are the ones which I wear. So these have to be, as well as the N95, you have to be fit tested. So you go through a process where someone kind of fit test you for that, because not every size fits everyone. And there are some people who won't fit into any of those sizes, like the medium, the small, or the large. So for them, they have a special thing called PAPR. It's a hood you put around, and it's connected to a machine, which kind of, you tie up on your back, which kind of cleans the air. So yeah, you got to be really cautious if you're using public transport. If possible, please avoid it. Especially right now where the cases are going up in the community. But if really needed, then you can do the face mask, some kind of eye shields, and social distancing. And if it is open, open ventilation where it's not like closed, then yes, you can do it, but not recommended.
Okay, thank you.
Sorry.
I have to add something.
Yes.
Because we see like everybody is wearing mask, but most of the time we have to make sure it closed, sealed enough, our nose above it, and wear it properly. It doesn't mean that if we have just a mask on the face doesn't protect. We have to wear it properly. Then only it does the purpose. Also, this is the face mask we use in the hospital. This is reusable, so you can reuse this. The other N95, what I was mentioning, it's disposable. That has a special filter, and we put this mask on top of that mask to make sure we are safe. While we interact with the patients inside the room, we ask the patients also to wear face mask if it is possible. If the patient is on ventilator or ICU, it is not possible. But if the patient is tolerable, we ask them to wear the face mask to limit the exposure of the patients. The other way, we try to limit the entry of the healthcare workers to go inside the negative pressure as much as possible. We cluster the care as nurses, and also we use the communication techniques like an iPad, Zoom, and also walkie-talkie to talk to the patients. Yeah, this is one of the Zoom iPad or video iPad we use for interpreter technology to talk to the patients.
How are you dealing with the time of COVID-19, specifically to take care of yourself and healthcare workers?
As other aunties mentioned, we all were stressed out initially because we didn't know anything about this virus. So I was also stressed due to my small children. I do have asthma, so there are some few high-risk patient population, diabetes, hypertension, asthma. So initially I was also stressed. And also I had to support my staff, so I couldn't show my stress. So I started doing yoga and meditation. It's really helped. That's the biggest benefit of what I have learned. And I also learned how to be more express the gratitude, because I see more people suffering. And we should be so thankful to what we have, and what, we should have that positive attitude all the time.
Treating COVID patients, or just patients in general, affected your family time?
Not just working with the COVID patients, but also seeing other patients, because some of them are asymptomatic and you don't know if they have it or not, and you don't want to bring it to your family or loved ones. So as I said, the precautions of changing into a different set of clothes when you're in the hospital, and then taking a shower either before leaving the hospital or coming back into the house right away without touching anything else, wiping everything down, including your cell phone, because I carry that with me. I get a lot of messages and pages from the nurses and the staff on my phone. So as soon as I come in, I put a clingy wrap around it to take that out, wipe it down with the alcohol wipes, and then I don't let my kids touch it, at least for the next 15 minutes, because they love my phone. And wearing something to cover my head, I take out the cap and then wash my hair, to putting my clothes separately for laundry. All those things are what I've been doing. Taking care of any type of patients now, because as I said, some might be asymptomatic and you don't know.
Okay.
What about you? What about you, Keerthi?
As you said, before I leave as soon as I finish my work, I come to my locker room, I clean everything before I leave the place, including my badge, phone, everything I clean with the wipes. Before I leave the hospital, then as she said, I had the habit of washing my clothes separate even before the COVID thing. I never mix my work clothes with the regular clothes. And even wherever I go, I always take the hand sanitizer before I get into the car. After when we go everywhere, before we touch the door, use the hand sanitizer to clean my hands, and to take all the precautions we can. Sometimes it's, even though we take it, but we do our part and stay healthy.
Okay, thank you. I think Ishaan also has a question.
Do you take vacation?
We do take. I'm sorry. Did you ask vacations?
Yes. Do you take off from work for a long amount of time?
Yeah, we do take vacations because working in healthcare can be pretty stressful, and I think any type of job can be stressful when you're working at a stretch. So we need time to kind of wind down and just relax so that you are re-energized before you go back to work. So right now, since the pandemic has started, we haven't traveled anywhere, but I do take days off so I can spend time with my family, with my kids. We go out for walks or for biking, and I started taking up gardening, which was kind of soothing for me after long days of work. Coming back in the evening and looking at those little plants that I have kind of planted, if they are growing, that kind of gives me so much of relief. So I was doing new things to kind of de-stress myself after coming back home.
I know you have children of your own, and how do they feel with you working?
At first, when I started working, of course it was, we didn't know a lot about it. We were scared. But as soon as we come home, whatever the measures I should take, I take. Wash my hands, remove all the uniform, wash it right away, take a shower. All the precautions so that I don't spread any infection for my children or my family. And even at work also, whatever the precautions that I need to take, I take so that I don't bring anything home. I wasn't scared or anything. I'm not scared anymore. At the beginning, we didn't know what is to expect or what's happening. We didn't know, so we were a little bit nervous at that time. But I think we're okay now. The children are fine. Yeah.
Right after treating a COVID patient, are they scared or are they just sad? How do they react?
Should we ask the kids?
Well, in the beginning, I was kind of creeped out that my mom was sleeping in another room because I didn't know what was happening, because I thought it would be fine, but then I realized you had to stay in a different room in the same house in order to be really safe. So that was the only time I was really freaked out. But after that, I felt totally normal. I knew I couldn't hug them. I'd started, and then I realized that they're coming home, so it's best to leave them alone for a minute. So I think it was okay. I wasn't that scared or anything, but yeah.
So my mom also works in the health department, and whenever she comes home, she works in the day and then she comes back nighttime, and then whenever she comes back, that's when we usually eat dinner, right? And kind of scared me at a moment, because whenever we ate dinner all together, she would sit in another room. This would be the main dining room, and there's another dining room in the kitchen, so we would both split up, and that always scared me a bit. But after a little bit, she started sitting with us because she got less and less anxious. But it turned out fine.
Well, sometimes I can feel worried, but I know sometimes I really feel really worried that sometimes you can catch COVID, because sometimes when you cough or something and you're it's something else, I don't know, I get really worried. That's just sometimes, but I know really deep down that you are safe and you're taking care of others, and that is what matters most.
Thank you so much. I think this is the end of our interview. Thank you so much for your time.
Getting ready for Thanksgiving?
Yes.
Yeah.
So,
Talking about Thanksgiving, what is your favorite food to eat in a Thanksgiving dinner?
oh, what can I say? I like mac and cheese. How about you all?
Ooh, mac
I
and
like
cheese.
Mashed
I
potato?
like mashed potatoes.
Yeah, me too. I like mashed potatoes and turkey. Oh, turkey with gravy is good too.
So everybody stay safe. Stay out of crowded place and keep distance, mask, everything. Whatever you can do to protect you and family.
If you have a get together, make sure the 6 feet distance is maintained while you are eating. If you don't have face mask and stuff like that. I know it is different for our culture, but please make sure we don't want, the COVID-19 is affecting the patients differently. So we cannot predict how they are going to react.
My special advice for this thing is stay healthy and stay safe at home. No more gatherings, not like last Christmas and all, we miss everything. But hope we'll get the vaccine soon.
Thank you. I want to thank each one of you kids for organizing this. It's been amazing, and I wish you all the very best. And be safe. We're gonna get out of this very soon. Just hanging tight.
Thanks for coming.
Thank you for hosting this and appreciating our work. And happy Thanksgiving, happy holidays.
Happy holidays.
Thanks so much for coming.
Thank you.
Thank you. Happy Thanksgiving.
We would like to give our special thanks to Preeti Auntie, Bindu Auntie, Rajmal Auntie, and Tini Auntie for accepting our invitation and joining our Thanking You event. We learned a lot from these aunties and we're extremely grateful for everything that they do. I would also like to give special thanks to Aditri, Ananya, Gautham, Ishaan, and Keerthi for joining us to do the interview. Thanksgiving was on Thursday, but as you know, we should start our day by giving thanks and end our day in reflection. As the quote goes, in life, one has a choice to take one of two paths, to wait for some special day or to celebrate each special day. Remember to thank your parents, teacher, housekeepers, postmen, trash and recycle workers, lawn keepers, and anyone who brings a positive difference into your life. As you wake up tomorrow, say what Maya Angelou said. This is a wonderful day. I've never seen this one before. This is Anjali signing off for today.